How accurate is lipid panel testing for diagnosing dyslipidemia? Have you ever wondered how reliable lipid panel testing is when it comes to diagnosing dyslipidemia? Let's break it down in a straightforward way. Lipid panel testing is a common method used to assess cholesterol and triglyceride levels in the blood. This test measures total cholesterol, low-density lipoprotein cholesterol, often referred to as bad cholesterol, high-density lipoprotein cholesterol, known as good cholesterol, and triglycerides. These measurements play a significant role in evaluating cardiovascular risk and guiding treatment for hyperlipidemia and cholesterol management. The accuracy of lipid panels can vary based on a few factors. One major consideration is whether the blood sample is taken after fasting or not. Traditionally, individuals were advised to fast for 9 to 12 hours before the test to get the most accurate triglyceride and low-density lipoprotein cholesterol levels. However, recent studies suggest that non-fasting lipid panels can still provide reliable results for initial screenings in most adults. This is especially true for total cholesterol and high-density lipoprotein cholesterol. Non-fasting tests are more convenient and can effectively detect dyslipidemia, although very high triglyceride levels might still need a fasting test for confirmation. Another factor to consider is the use of point-of-care testing devices. These portable analyzers, used outside traditional laboratory settings, show good accuracy but can be somewhat variable. Devices like the CardioCheck PA and Mission analyzers are known for their high sensitivity and specificity for triglycerides and provide reasonable accuracy for low-density lipoprotein and high-density lipoprotein cholesterol. While these tools are great for quick screenings, it is still recommended to follow up with confirmatory lab tests for a definitive diagnosis. Standard laboratory lipid panels remains the gold standard for diagnosing dyslipidemia. They offer precise measurements of lipid fractions and are essential for monitoring treatment responses and assessing cardiovascular risk. It is also important to interpret lipid panel results in the context of other risk factors. Factors such as age, diabetes, hypertension, and a history of cardiovascular disease should be considered. Risk calculators often combine lipid values with these factors to help guide clinical decisions. In practical terms, lipid panel testing is a reliable first step for diagnosing dyslipidemia and assessing cardiovascular risk related to cholesterol abnormalities. While non-fasting tests and point-of-care devices offer convenience and good accuracy, fasting laboratory tests are still important for precise diagnosis and management, especially when triglyceride levels are high or treatment decisions are complicated. Regular monitoring and a thorough evaluation can help optimize outcomes in managing hyperlipidemia and reducing cardiovascular risk.